Hello and welcome to today's lesson on radiation in medicine, which is part of the atomic structure topic in GCSE Separate Science Physics. So in today's lesson we're going to try and look at selecting suitable radioactive isotopes for medical uses. So in today's lesson, if we've been successful, we should be able to describe how a medical tracer, medical implant and radiotherapy works, discuss the properties of a medical tracer and a radiotherapy isotope, and select an appropriate radioisotope for medical treatment. Now, this links to the following part of the GCSE Separate Science Physics Specification 4.4.3.3 Uses of Nuclear Radiation, which is separate science only content. Now, radioactive substances are used a lot in medical scanning and treatment. Now, many hospitals have a nuclear physics department and many hospitals employ radiographers to carry out scanning techniques and treatments. So many different hospitals will actually have a medical physics and nuclear physics department. So there are three different areas to medical physics. You've got diagnosis, which is the use of nuclear radiation to diagnose an illness or condition. Now, included in these processes are things like x-rays and CT scans. You've then got monitoring, which is the use of nuclear radiation to monitor the mechanisms of the body. Now, this includes medical tracers. And finally, you've got treatment, which is the use of nuclear radiation to treat illnesses or conditions. Now, this can control or destroy unwanted tissues, and this includes radiotherapy. So we're going to look at each of these different areas of nuclear medicine and how this links into the radioactive isotopes. So we're going to start by looking at medical tracers. Now, a use for radioactivity in the real world is a tracer to trace the flow of a substance through a system. Now, an example of this would be to monitor a patient's kidney. Now, a medical tracer is used to monitor how organs work in the body. It can also be used to see if any cancerous cells have formed around an organ. Now, different substances can be used as tracers in the human bodies. This is because different substances are taken up by different organs. So the most common radioactive isotope used as a tracer is iodine, and it's used to monitor the kidneys and the thyroid. Now, this is because these organs take up iodine very easily. So we say iodine has an organ affinity for the kidneys and the thyroid. Now, the organ affinity of a substance determines the substance used as a medical tracer. So medical tracers can either be injected into the bloodstream or ingested through food. Now, the medical tracer is normally mixed with sugar to make radioactive sugar before it's eaten. Now, radioactive sugar is very common in medicine because sugar has an affinity for cancer cells, because cancer cells respire at a very fast rate, so require this sugar. So this means this radioactive sugar is used as a tracer to detect cancer cells. So the tracer should emit gamma radiation, as gamma radiation is the only radiation which can reliably leave the body and then be detected outside of the body. So cameras are set up to detect gamma radiation, and we call those gamma cameras. So the medical tracer will then link to a gamma camera and can produce the following images. Now, radioactive nuclei behave chemically exactly like their non-radioactive equivalent, so they can be used to watch movements of chemicals through the bodies. So doctors can use radioactive iodine to look at how well the kidneys are working. So firstly, the patient is injected with a small amount of a chemical containing radioactive iodine. Now remember, most of this injection is not radioactive. Now, doctors then use special radiation gamma cameras to then detect the radioactive iodine which is in the kidneys. Now, the gamma cameras measure the radioactive iodine present by measuring the amount of gamma radiation it emits. So these images show what happens when with radioactive traces as they move through the body. So the amount of radiation detected found in the different parts of the body can be used to diagnose the patient. So you can look at the ways in which the concentration changes as the kidneys clear it from the blood. So you can see in these particular situations what's going on. So you can see at the points where the radioactive isotope is accumulated in different parts of the body. Now, the amount of radiation detected found in different parts of the body can be used to diagnose the patient. So what's actually going on? So in this particular situation, as the kidney filters the chemical out, you can see the concentration in the blood falling whilst the chemical passes into the kidneys and the level rises, and once the kidney filters out the chemical, you can see the concentration falling. So what's going on in this situation? Well, you can see that the left hand side kidney is working well as it filters out the chemical. You can see this because the concentration of the radioactive isotope is falling in the left kidney, but in the right kidney it's collecting iodine but it's not passing it out properly. You can see this because the concentration is staying high. So as a medical practitioner, you can diagnose there's an issue with the right kidney. Now, radioactive substances such as radioactive iodine or radioactive sugar can be put into the body for diagnosis as part of a compound designed to target part of the body studied. Now, once in the body, the gamma radiation given off by the radioactive isotope is detected by a gamma camera. The gamma camera takes a series of images to show how the tracer moves through the body. So the gamma cameras are used to take images of internal body organs. The gamma camera can only detect gamma rays from the nuclei directly in front of it. So the camera builds up an image of where the radioactive isotope is located. Now, the most common type of tracer can be found in a PET scan. Now, in these scans, radioactive sugar is injected into the body. This travels to be used by cancer cells. This tracer then emits gamma rays, which can then be seen by a gamma camera. This can be rotated around the patient so the computer can build up a 3D image on the screen. Now, the most common uses of tracers in medicine are for brain activity, so using tracers that target neuron activity, tumor detection, using tracers that show active cells indicating how aggressive a tumor is, detecting inflammation or infection, using a gallium tracer indicates the location of an infection, and kidney disease, as tracers can reveal kidney function. Now, what factors determine the substance that we use as a medical tracer? Well, there are a couple. Firstly, the radioactive emission. The isotope must give off enough gamma radiation to be detected by a gamma camera, and this will allow the radiation to be useful whilst doing as little damage as possible. So gamma radiation should be emitted by the radioactive isotope as it's weakly ionizing but highly penetrating. The half-life is another factor which determines the substance used as a medical tracer. The substance should have a relatively short effective half-life, so it doesn't remain in the body for too long. However, the substance should stay in the body long enough for diagnosis to be carried out. So the isotope should not last in the body for more than a few weeks, so therefore it's got to have a half-life of a few days. You've also got to consider its toxicity, because you've got to have an isotope which after it decays does not turn into a toxic product. If a toxic product was produced as the trace was inside the body, this could cause severe harm to the person. So the isotope produced from the decay should be stable. So radioactive isotopes can be put into the body for diagnosis. Once in the body, the gamma radiation given off by the radioactive isotope is detected by the camera. The gamma camera then takes a series of images to show how the tracer moves through the body. Now, we must use a radioactive tracer which has a half-life of a few days, so it lasts long enough for the test to be done, but decays completely after a few weeks, emits gamma radiation so it's detected outside of the body, and then decays into a stable product which does not harm the body. Now, another use for ionizing radiation in medicine is to treat illness. Now, the most common illness treated with radiation is cancer. Now, this process is called radiotherapy. Now, please don't confuse this with chemotherapy, which is the treatment of illnesses with chemicals. Now, radiotherapy works as ionizing radiation will ionize and mutate cancer cells. Now, this can kill cancers or stop cancerous tumors growing or stop the symptoms of cancer. Now, this ionizing radiation can be given either outside of the body or inside of the body. But we've got an issue. This ionizing radiation can also cause healthy, non-cancerous cells of the body to be ionized and mutated as well. So we need to minimize the radiation dose to healthy cells. So gamma rays need to be carefully directed and in just the right dosage be given to kill the cancer cells without damaging too many normal healthy cells. So the dose of radiation can be reduced to healthy cells by rotating the body around during this process. So this means that the tumor is continually irradiated, but the healthy cells irradiated changes each time. The dose can be reduced to healthy cells by giving the body time to recover in between doses of radiotherapy. So the dose finally of can be reduced to healthy cells by giving the body time to recover in between the doses of radiotherapy, and the different doses of radiotherapy are called fractions. So in external radiotherapy, a source of ionizing radiation, normally a radioactive source of gamma rays, is directed at a tumour. The treatment is repeated at intervals designed to give a chance for healthy cells to recover, and the individual treatments are called fractions. Now, gamma emitters are used for external radiotherapy, as it's the only radiation that will penetrate deep into the body. Now, internal radiotherapy is when a radioactive substance is placed inside the body. The patient is injected or swallows a radioactive substance. Now, a radioactive material or implant is implanted into the patient near the tumour. Now, this method is called brachytherapy. Now, it's important that alpha or beta emitters are used, as they're placed as small seeds or tiny rods next to cancerous tumours. Now, alpha and beta radiation emitters are used because they don't have to travel far, as it's in the body already, and they're the most ionizing type of radiation, so are the most likely to destroy cancer cells. Now, implant radiotherapy can be very effective, as it uses radiation with a greater ionizing power than external radiotherapy, and it can target a particular organ. Now, the half-life of the implant must be long enough to be effective, but short enough that it doesn't continue to irradiate the patient after treatment. Now, ionizing radiation can be used to control or destroy unwanted tissue in the body, which we call radiotherapy. The radiation can either be given from outside the body, external radiotherapy, or inside the body, internal radiotherapy. Now, radiotherapy can be used to treat cancer, alleviate the symptoms of cancer, shrink tumours, or totally irradiate the body. Now, the radioisotopes used in radiotherapies must have the following properties: must produce lots of gamma radiation if external, or alpha and beta radiation if an implant, have a long half-life if external, or have a short half-life if an implant, and be easy to target different parts of the body. Now, it's important to note that damage will be done to healthy cells, which can make the patient feel very ill, but if the cancer is successfully killed off, then it's worth it. Now, for every medical situation, you must consider the benefits and risks of using radioactive materials. Now, radioactive materials should only be used if the benefits of the procedure outweigh its risks. So for many patients, radiotherapy is chosen as the benefits of the treatment outweigh the risk that it poses to the particular patient. Now, therefore, it means it's very important that patients are educated in the use of radioactive materials in medicine, so they can make an informed choice on their treatment, and have the perceived risk that the patient feels that they have is the actual risk that they are going to face by using the radioactive material. Now, let's summarize what we've learned in today's lesson. Nuclear radiations are used in medicine for the exploration of internal organs and for the control or destruction of unwanted tissues, and you should be able to describe and evaluate the uses of different nuclear radiations for the exploration of internal organs and for the control or destruction of unwanted tissue, and evaluate the perceived risks or uses of nuclear radiations in relation to the given data and the consequences. Now, if you've been successful and learnt in today's lesson, you should be able to describe how a medical tracer, a medical implant, and radiotherapy works, discuss the properties of a medical tracer and a radiotherapy isotope, and select an appropriate radioisotope for medical treatment. So I hope you've enjoyed today's lesson on radiation in medicine, which is part of the atomic structure topic in GCSE Separate Science Physics. Thank you very much for listening, and have a lovely day.